Question 1. Governance review demonstrates that a family is experiencing significant distress following the recent death of an advanced cancer patient under the AOCNS care. The family has expressed confusion regarding the patient's final days and appears overwhelmed by their emotions. Which of the following approaches best aligns with best practice for providing grief and bereavement support in this context? Option A. Facilitate a family meeting to discuss the patient's prognosis, the anticipated grieving process, and available support resources. Option B. Defer all grief counseling to the hospital chaplain, as this is outside the AOCN's primary scope of practice. Option C. Avoid discussing the patient's prognosis or the concept of grief, assuming the family will initiate these conversations when they are ready. Option D. Provide the family with a general pamphlet on grief and bereavement, and advise them to seek support if needed. The correct answer is A. Facilitate a family meeting to discuss the patient's prognosis, the anticipated grieving process, and available support resources. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the advanced oncology certified clinical nurse specialist AOCNS to navigate the complex emotional landscape of grief and bereavement in a patient's family while adhering to established best practices and regulatory guidelines for end-of-life care. The family's distress and potential for misunderstanding the grieving process necessitate a sensitive, informed, and ethically sound approach. The AOCNS must balance providing immediate support with ensuring long-term well-being for the family, all within the scope of their advanced practice role and the governing healthcare framework. Correct approach analysis. The correct approach, which involves facilitating a family meeting to discuss the patient's prognosis, the anticipated grieving process, and available support resources, represents best professional practice. This aligns with ethical principles of patient-centered care, beneficence, and non-maleficence. It is also consistent with regulatory frameworks that emphasize comprehensive palliative and end-of-life care, including psychosocial support for families. By proactively addressing the family's needs, the AOCNS demonstrates adherence to guidelines that promote open communication, shared decision-making, and the provision of appropriate resources, thereby minimizing potential distress and promoting healthy adaptation to loss. This approach respects the family's autonomy and their right to information and support. Incorrect approach is analysis. One incorrect approach involves deferring all grief counseling to a chaplain without direct AOCNS involvement. This fails to recognize the AOCNS' advanced role in oncology care, which includes expertise in managing complex psychosocial needs of patients and families. Regulatory and ethical guidelines for advanced practice nurses mandate their active participation in holistic patient care, including psychosocial support. Relying solely on another discipline without collaborative assessment or intervention can lead to fragmented care and may not adequately address the specific oncology-related grief experienced by the family. Another incorrect approach is to provide generic information about grief without tailoring it to the family's specific situation or offering concrete support mechanisms. This approach is insufficient because it lacks the personalized and empathetic engagement required in oncology bereavement. Best practices and ethical standards dictate that support should be individualized, acknowledging the unique impact of cancer on the patient and their loved ones. Failing to offer tailored resources or ongoing support can leave the family feeling abandoned and unsupported during a critical time. A third incorrect approach is to avoid discussing the patient's prognosis and the potential for grief, assuming the family will initiate these conversations. This passive stance is contrary to the proactive and compassionate care expected of an AOCNS. Regulatory frameworks and ethical codes emphasize the importance of open communication and preparing families for end-of-life events. Avoiding these sensitive topics can create barriers to trust and hinder the family's ability to process their emotions and make informed decisions, potentially leading to increased distress and unresolved grief. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient and family well-being, adheres to ethical principles, and complies with regulatory requirements. This involves 1. Comprehensive assessment, thoroughly assessing the family's emotional state, understanding of the situation and support needs. 2. Collaborative planning, developing a care plan in conjunction with the patient if able, family, and interdisciplinary team. 3. Open communication, facilitating honest and empathetic discussions about prognosis, treatment goals, and the grieving process. 4. Resource provision. Identifying and offering appropriate psychosocial, spiritual, and practical support services. 5. Ongoing evaluation. Continuously monitoring the family's progress and adjusting support as needed. This systematic approach ensures that care is holistic, patient-centered, and ethically sound. Question 2. Investigation of current clinical practice guidelines and recent research findings reveals significant advancements in the application of immunotherapies for various oncologic malignancies. Considering the distinct mechanisms of action and potential adverse event profiles, which of the following approaches best reflects the current standard of care for an advanced oncology certified clinical nurse specialist, AOCNS, when evaluating and recommending immunotherapy options for a patient with advanced non-small cell lung cancer? Option A. Focusing on immunotherapies that have the longest established track record in oncology, even if newer agents have shown superior outcomes in recent studies. Option B. Recommending immunotherapy based on the patient's historical response to chemotherapy, assuming similar immune modulation effects. Option C. Conducting a comprehensive review of evidence-based guidelines and recent clinical trial data to identify immunotherapies with proven efficacy and acceptable toxicity profiles for the specific subtype and stage of non-small cell lung cancer, considering patient-specific factors. Option D. Prioritizing immunotherapies that have demonstrated broad efficacy across multiple cancer types, irrespective of specific molecular targets or immune checkpoint inhibitors utilized. Correct answer is D. Prioritizing immunotherapies that have demonstrated broad efficacy across multiple cancer types, irrespective of specific molecular targets or immune checkpoint inhibitors utilized. Explanation. This scenario presents a professional challenge due to the evolving landscape of cancer treatment and the critical need for advanced practice nurses to stay abreast of evidence-based practices and regulatory guidelines. The complexity arises from the distinct mechanisms of action, potential toxicities, and monitoring requirements of different immunotherapy classes, necessitating a nuanced understanding for optimal patient care and safety. The correct approach represents best professional practice because it aligns with the core principles of advanced oncology nursing, emphasizing patient-centered care, evidence-based decision-making, and adherence to regulatory frameworks governing the administration and management of novel therapeutics. Specifically, it reflects the AOCNS' responsibility to critically evaluate and integrate current research and guidelines into clinical practice, ensuring that treatment decisions are informed by the latest scientific understanding and are tailored to individual patient needs and disease characteristics. This approach prioritizes patient safety by acknowledging the unique toxicity profiles of each immunotherapy class and the importance of proactive management strategies, which is a cornerstone of advanced practice nursing and aligns with the standards of care expected for certified specialists. An incorrect approach that fails to differentiate between immunotherapy classes would represent a significant regulatory and ethical failure. Such an approach could lead to inappropriate treatment selection, inadequate monitoring for specific adverse events, and potentially suboptimal patient outcomes. Ethically, it violates the principle of beneficence by not providing the most effective and safest care possible. From a regulatory standpoint, it could be seen as a deviation from established standards of care and potentially a breach of professional accountability, as advanced practitioners are expected to possess and apply specialized knowledge. Another incorrect approach that relies solely on historical treatment paradigms without incorporating recent advancements in immunotherapy would also be professionally unacceptable. This would fail to leverage the significant progress made in understanding and utilizing immunotherapies, potentially denying patients access to more effective or less toxic treatment options. This represents a failure to uphold the professional obligation to provide up-to-date care and could be considered a form of negligence in a regulatory context, as it implies a lack of engagement with current best practices. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, disease characteristics, and available treatment options. This includes a thorough review of current evidence-based guidelines, clinical trial data, and regulatory pronouncements relevant to the specific cancer type and stage. Advanced practitioners must then critically analyze the mechanisms of action, efficacy, and toxicity profiles of different immunotherapies considering the patient's comorbidities, performance status, and personal preferences. Collaboration with the multidisciplinary oncology team, including physicians, pharmacists, and other specialists, is crucial to ensure a comprehensive and individualized treatment plan. Ongoing monitoring for treatment response and adverse events, with prompt and appropriate management, is also a critical component of this decision-making process. Question 3. What factors determine the susceptibility of a tumor to cell cycle-specific chemotherapeutic agents and the potential for resistance development, considering the fundamental disruptions in normal cell cycle regulation that characterize oncogenesis? Option A. The availability of palliative care services and the patient's expressed desire for comfort measures only. Option B. The historical use of broad-spectrum cytotoxic agents in the patient's treatment regimen, without regard to the tumor's underlying cell cycle defects. Option C. The patient's overall health status and performance status, irrespective of the tumor's specific cell cycle vulnerabilities. Option D. The specific cell cycle checkpoints that are dysregulated and the molecular mechanisms by which these checkpoints are bypassed or inactivated, alongside the tumor's inherent capacity for DNA repair and the emergence of mutations in drug target pathways. The correct answer is D. The specific cell cycle checkpoints that are dysregulated and the molecular mechanisms by which these checkpoints are bypassed or inactivated, alongside the tumor's inherent capacity for DNA repair and the emergence of mutations in drug target pathways. Explanation. This scenario is professionally challenging because it requires the advanced oncology certified clinical nurse specialist AOCNS to integrate complex knowledge of cell cycle regulation with the practical realities of patient care and the evolving landscape of cancer therapies. The AOCNS must not only understand the theoretical underpinnings of oncogenesis, but also apply this knowledge to anticipate treatment responses, potential toxicities, and the development of resistance, all within the strict regulatory and ethical framework governing advanced practice nursing in the United States. Careful judgment is required to differentiate between normal cellular processes and aberrant ones that drive malignancy, and to understand how various interventions can disrupt these processes. The correct approach represents best professional practice because it directly addresses the core of cancer development as a disruption of normal cell cycle control. Understanding the specific checkpoints, e.g., G1/S, G2/M, and the molecular players involved, e.g., cyclins, cyclin-dependent kinases, tumor suppressor proteins like p53 and Rb, is fundamental to comprehending how cells lose their normal regulatory mechanisms and become cancerous. This knowledge informs the selection of targeted therapies that exploit these dysregulations, the prediction of resistance mechanisms that arise from further mutations in these pathways, and the management of side effects that often stem from the impact of therapy on rapidly dividing normal cells. Adherence to U.S. regulatory frameworks, such as those established by the Nurse Practice Acts of individual states and the guidelines from professional organizations like the Oncology Nursing Society (ONS), ensures that the AOCNS practices within their scope and provides evidence-based, safe, and ethical care. An incorrect approach that focuses solely on the genetic mutations without considering the cell cycle context fails to capture the dynamic nature of cancer development. While mutations are the root cause, it is their impact on cell cycle progression and regulation that drives uncontrolled proliferation. Another incorrect approach that prioritizes symptom management over understanding the underlying cell cycle dysregulation overlooks the opportunity for targeted interventions and proactive management of treatment resistance. Focusing on broad-spectrum chemotherapy without considering specific cell cycle phase targeting would be a less precise and potentially more toxic approach. An approach that neglects the patient's individual genetic profile and tumor biology and instead relies on generalized cell cycle knowledge would be ethically problematic as it fails to provide personalized care, potentially leading to suboptimal outcomes and increased risk of adverse events, violating principles of beneficence and non-maleficence. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's tumor biology, including known genetic alterations and their impact on cell cycle regulation. This should be followed by an assessment of the patient's overall health status and treatment goals. The AOCNS should then consult relevant evidence-based guidelines and research to identify therapeutic strategies that specifically target the identified cell cycle abnormalities or their downstream effects. Continuous monitoring of treatment response and the emergence of resistance mechanisms, informed by an understanding of cell cycle dynamics, is crucial for adapting care plans and optimizing patient outcomes within the established U.S. regulatory and ethical standards for advanced practice nursing. Question 4. When evaluating a patient with a newly diagnosed, advanced stage malignancy who expresses a strong desire to forego all curative and palliative treatments in favor of solely focusing on comfort measures at home, despite the availability of potentially life-prolonging therapies, what is the most ethically and professionally sound initial nursing action? Option A. Immediately document the patient's decision in the medical record and proceed with arranging for home-based comfort care as requested, without further discussion to respect their autonomy. Option B. Initiate a comprehensive assessment to understand the patient's rationale, values, and comprehension of their diagnosis and treatment options, while also exploring their understanding of comfort measures and their potential limitations. Option C. Contact the patient's family to discuss the patient's wishes and seek their input on the best course of action, as family consensus is paramount in such situations. Option D. Present the patient with a detailed list of all available treatment options and their statistical success rates, emphasizing the potential for cure to encourage them to reconsider their decision. The correct answer is B. Initiate a comprehensive assessment to understand the patient's rationale, values, and comprehension of their diagnosis and treatment options, while also exploring their understanding of comfort measures and their potential limitations. Explanation. This scenario presents a professional challenge rooted in the core principles of oncology nursing, specifically the ethical imperative to respect patient autonomy while ensuring their safety and well-being. The nurse must navigate the complex interplay between a patient's expressed wishes, their understanding of their prognosis, and the potential for harm. The challenge lies in balancing the patient's right to self-determination with the nurse's professional responsibility to advocate for the patient and provide care aligned with best practices and established guidelines. The correct approach represents best professional practice because it prioritizes open, honest, and compassionate communication. It involves a thorough assessment of the patient's understanding, values, and decision-making capacity, followed by a collaborative discussion that explores all available options and their potential consequences. This approach aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. It also adheres to the professional standards of oncology nursing, which emphasize patient-centered care and shared decision-making. An incorrect approach that involves overriding the patient's wishes without a clear and documented assessment of diminished capacity or immediate danger would represent a failure to uphold patient autonomy. This could violate ethical guidelines regarding informed consent and patient rights. Another incorrect approach, such as withholding information or presenting a biased view of treatment options, would be a breach of the principle of veracity and could lead to a patient making decisions based on incomplete or inaccurate information, thereby undermining their autonomy and potentially causing harm. Failing to involve the interdisciplinary team when faced with complex ethical or clinical challenges would also be a professional failing, as collaborative care is essential in oncology. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's understanding of their condition, prognosis, and treatment options. Second, explore the patient's values, beliefs, and goals of care. Third, engage in open and honest communication, providing accurate and unbiased information. Fourth, involve the interdisciplinary team, including physicians, social workers, and ethics consultants if necessary. Fifth, document all assessments, discussions, and decisions meticulously. Finally, continuously reassess the patient's situation and adjust the plan of care accordingly, always prioritizing the patient's well-being and autonomy within the bounds of ethical and legal practice. Question 5. Quality control measures reveal a pattern of inconsistent administration of a new targeted therapy infusion protocol among several oncology nurses, specifically regarding the pre-infusion laboratory parameter checks and the timing of dose adjustments based on patient response. Option A. Report the observed deviations to the unit manager and request that they address the issue directly with each nurse, emphasizing the importance of strict protocol adherence without further direct involvement in the educational aspect. Option B. Implement a mandatory hands-on competency validation session for all oncology nurses involved in administering this targeted therapy, followed by a review of the updated protocol with a focus on the rationale behind the specific checks and adjustments, and establish a system for peer observation and feedback for the first month of protocol implementation. Option C. Acknowledge the variations, but consider them minor deviations that do not significantly impact patient outcomes, and rely on nurses' experience to manage these situations on a case-by-case basis. Option D. Immediately issue formal written warnings to all nurses identified as deviating from the protocol, citing patient safety risks, and requiring them to attend a mandatory remedial training session within 48 hours. Correct answer is B. Implement a mandatory hands-on competency validation session for all oncology nurses involved in administering this targeted therapy, followed by a review of the updated protocol with a focus on the rationale behind the specific checks and adjustments, and establish a system for peer observation and feedback for the first month of protocol implementation. Explanation. The scenario presents a common challenge in oncology nursing, ensuring consistent, evidence-based care delivery across a team, particularly when new protocols are implemented. The professional challenge lies in balancing the need for adherence to established best practices with the autonomy and experience of individual nurses, while always prioritizing patient safety and optimal outcomes. Careful judgment is required to identify and address deviations from protocol without undermining team morale or individual competence. The correct approach represents best professional practice because it directly addresses the identified quality gap through a structured, educational, and collaborative process. This aligns with the core principles of professional nursing practice, which emphasize continuous learning, evidence-based care, and patient advocacy. Specifically, it adheres to the ethical imperative to provide competent care and the regulatory expectation for healthcare facilities to maintain quality assurance programs. By focusing on education and skill reinforcement, it promotes a culture of safety and learning, rather than punitive action, which is more effective in achieving sustained improvement. This approach also respects the nurse's professional development and encourages engagement in quality improvement initiatives. An incorrect approach that focuses solely on immediate disciplinary action without understanding the root cause fails to address the underlying issue and can create a negative work environment. This may violate ethical principles of fairness and due process, and potentially regulatory requirements for progressive discipline and performance improvement plans. Another incorrect approach that dismisses the findings as minor or isolated overlooks the potential for systemic issues and the cumulative impact of deviations on patient care. This demonstrates a failure in the quality control process and a disregard for the regulatory mandate to ensure safe and effective patient care. Finally, an approach that involves bypassing the direct care nurse to address the issue with their supervisor without first engaging the nurse directly can be perceived as undermining and may not provide the nurse with the opportunity to understand and correct their practice, potentially leading to further misunderstandings and a breakdown in communication, which is contrary to best practices in team collaboration and professional development. The professional decision-making process for similar situations should involve a systematic approach. First, clearly identify the deviation from best practice and the potential impact on patient care. Second, gather objective data and evidence to support the observation. Third, engage the individual nurse in a private, respectful conversation to understand their perspective and identify any barriers to adherence. Fourth, provide targeted education and resources to reinforce the correct practice. Fifth, monitor for improvement and provide ongoing support. If the deviation persists, then a more formal performance improvement plan may be necessary, always adhering to organizational policies and regulatory guidelines. This iterative process ensures that care is improved while supporting the professional growth of the nursing team. Question 6. The monitoring system demonstrates a patient with advanced metastatic lung cancer who has previously expressed a strong desire to forego further aggressive chemotherapy due to significant side effects and a desire for palliative care. However, the oncology team believes a new experimental therapy, while investigational, could offer a potential benefit and wishes to discuss its initiation with the patient. The patient's family is also expressing concern that the patient is not fully grasping the potential benefits of the experimental treatment, as the AOCNS, What is the most appropriate initial step to address this complex ethical and legal situation? Option A. Document the patient's previous refusal of aggressive chemotherapy and defer any discussion of new therapies until the patient or family explicitly requests it. Option B. Initiate a formal assessment of the patient's decision-making capacity to understand the proposed experimental therapy, its risks, benefits, and alternatives, and facilitate a discussion with the patient and their family regarding their values and goals of care. Option C. Inform the patient and family that the oncology team has decided to proceed with the experimental therapy based on clinical judgment, as it offers the best chance for survival. Option D. Proceed with discussing the experimental therapy with the patient, emphasizing the potential benefits as determined by the oncology team, and document the discussion. The correct answer is B. Initiate a formal assessment of the patient's decision-making capacity to understand the proposed experimental therapy, its risks, benefits, and alternatives, and facilitate a discussion with the patient and their family regarding their values and goals of care. Explanation. This scenario presents a significant ethical and legal challenge for an advanced oncology certified clinical nurse specialist, AOCNS, due to the potential conflict between patient autonomy, informed consent, and the clinical team's assessment of benefit versus burden. The core of the challenge lies in navigating a situation where a patient's expressed wishes may diverge from what the healthcare team believes is medically indicated or in the patient's best interest, particularly when the patient's capacity to make such decisions is in question. The AOCNS must balance respecting the patient's right to self-determination with their professional responsibility to advocate for the patient's well-being and ensure adherence to legal and ethical standards of care. The correct approach involves a comprehensive assessment of the patient's decision-making capacity, followed by open and empathetic communication with the patient and their family. This approach upholds the principle of patient autonomy, which is a cornerstone of ethical healthcare. It also aligns with legal frameworks that mandate informed consent and respect for patient wishes, provided the patient has the capacity to make such decisions. Engaging in a thorough capacity assessment, involving the interdisciplinary team, and facilitating shared decision-making are critical steps in ensuring that any treatment plan is ethically sound and legally defensible. This process respects the patient's dignity and right to participate in their own care, even when faced with difficult prognoses. An incorrect approach would be to unilaterally override the patient's stated preference based solely on the team's clinical judgment, or to proceed with a treatment plan without a formal capacity assessment. This would violate the ethical principle of autonomy and potentially the legal requirement for informed consent. Failing to involve the patient in the decision-making process, especially when their capacity is in doubt, can lead to a breach of trust and legal repercussions. Another incorrect approach would be to dismiss the patient's concerns or wishes without a thorough investigation into their underlying reasons or fears, which would be a failure of compassionate care and professional advocacy. The professional decision-making process for similar situations should begin with a clear understanding of the patient's current clinical status and prognosis. This should be followed by a formal assessment of the patient's decision-making capacity, which includes evaluating their ability to understand the information, appreciate the situation and its consequences, reason through options, and communicate a choice. If capacity is present, the focus shifts to ensuring truly informed consent through clear, understandable communication, addressing all patient questions and concerns, and exploring their values and goals of care. If capacity is impaired, the process involves identifying appropriate surrogate decision-makers and ensuring decisions are made in accordance with the patient's known wishes or best interests, always with the goal of preserving patient dignity and rights. Collaboration with ethics committees and legal counsel may be necessary in complex cases. Question 7. Process analysis reveals that a patient diagnosed with advanced breast cancer, who has expressed a strong desire to avoid chemotherapy due to a family history of severe side effects, is being considered for a treatment regimen that includes a novel targeted therapy known to inhibit specific pathways involved in epithelial mesenchymal transition, a key mechanism of metastases. The patient's family is also expressing concerns about the potential impact of any treatment on the patient's quality of life. As the Advanced Oncology Certified Clinical Nurse Specialist, AOCNS, you are tasked with facilitating the shared decision-making process. Which of the following approaches best navigates this ethically complex situation while adhering to the principles of advanced oncology nursing practice. Option A. Focus solely on the patient's expressed desire to avoid chemotherapy, suggesting that alternative, less aggressive palliative measures be considered immediately, without fully exploring the potential benefits of the targeted therapy in preventing metastatic spread. Option B. Inform the patient and family that due to their expressed reservations and the family's concerns, the decision to proceed with the targeted therapy is too complex and should be deferred to the primary oncologist, disengaging from the direct patient education and advocacy role. Option C. Gently but firmly explain to the patient and family that the targeted therapy is crucial for preventing metastases and that their concerns about side effects, while understandable, must be secondary to the immediate need to control disease spread, proceeding with the treatment plan as prescribed. Option D. Acknowledge the patient's and family's concerns. Provide detailed, patient-centered education on the specific mechanisms of metastases that the targeted therapy addresses and the evidence-based risk-benefit profile of this therapy compared to chemotherapy, and collaboratively explore any potential modifications or supportive care strategies to mitigate side effects, respecting the patient's ultimate decision. The correct answer is C. Gently but firmly explain to the patient and family that the targeted therapy is crucial for preventing metastases and that their concerns about side effects, while understandable, must be secondary to the immediate need to control disease spread, proceeding with the treatment plan as prescribed. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interest of their care, particularly when those wishes might be influenced by factors that could impede optimal oncological outcomes. The complexity arises from balancing patient autonomy with the nurse specialist's ethical and professional responsibility to advocate for evidence-based care that addresses the intricate mechanisms of metastases. Careful judgment is required to navigate this delicate ethical terrain without compromising the patient's dignity or the integrity of their treatment plan. The correct approach represents best professional practice because it prioritizes open, empathetic communication and patient education. By actively listening to the patient's concerns and providing clear, understandable information about the rationale behind the recommended treatment, the AOCNS upholds the ethical principle of informed consent. This approach respects patient autonomy while ensuring the patient has the necessary knowledge to make decisions aligned with their values and the best available oncological evidence regarding metastases. This aligns with the ethical guidelines for advanced practice nursing, which emphasize patient-centered care and shared decision-making. An incorrect approach that dismisses the patient's concerns without thorough exploration fails to uphold the ethical principle of respect for persons. It risks alienating the patient and undermining trust, potentially leading to non-adherence to treatment. This also violates the professional responsibility to educate and empower patients. Another incorrect approach that involves overriding the patient's wishes, even with the intention of providing better care, constitutes a violation of patient autonomy and could be construed as paternalistic, which is ethically unacceptable in advanced practice nursing. Furthermore, failing to document the patient's concerns and the rationale for any deviation from their stated wishes would be a breach of professional documentation standards and could have legal implications. Professional decision-making in such situations requires a systematic approach. First, actively listen to and validate the patient's concerns. Second, assess the patient's understanding of their diagnosis and treatment option, particularly concerning the mechanisms of metastases and how the proposed treatment addresses them. Third, provide clear, evidence-based information tailored to the patient's comprehension level, addressing their specific anxieties. Fourth, explore alternative options or modifications to the treatment plan that might align with the patient's preferences while still being oncologically sound. Finally, document the entire process, including the patient's expressed wishes, the information provided, and the shared decision-making process. Question 8. System analysis indicates that an advanced oncology certified clinical nurse specialist, AOCNS, is caring for a patient with advanced lung cancer who expresses a strong desire to receive a specific experimental therapy that is not currently part of the established standard of care for their condition. The patient states they have researched this therapy and believe it is their best option. The AOCNS has reviewed the available evidence and determined that, while the therapy has shown some preliminary promise in early trials, it carries significant risks and is not recommended by current clinical guidelines for this patient's stage and type of cancer. The patient appears to understand the basic concept of the therapy, but may not fully grasp the comparative risks and benefits against established treatments. Which of the following approaches best reflects the AOCNS' professional responsibility in this situation? Adhering to U.S. regulatory frameworks and ethical guidelines for patient advocacy and education in oncology. Option A. Proceed with the patient's requested experimental therapy without further discussion, assuming their research indicates sufficient understanding and acceptance of potential risks. Option B. Engage in a detailed, shared decision-making conversation with the patient, thoroughly explaining the risks, benefits, and alternatives of both the requested experimental therapy and the recommended standard of care, exploring the patient's values and goals, and documenting the discussion and the patient's informed decision. Option C. Immediately inform the patient that the requested therapy is not part of the standard of care and therefore cannot be considered, directing them to the approved treatment options. Option D. Focus solely on educating the patient about the risks of the experimental therapy, discouraging its pursuit without a comprehensive exploration of their values or the benefits of alternative treatments. Correct answer is B. Engage in a detailed, shared decision-making conversation with the patient, thoroughly explaining the risks, benefits, and alternatives of both the requested experimental therapy and the recommended standard of care, exploring the patient's values and goals, and documenting the discussion and the patient's informed decision. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Advanced Oncology Certified Clinical Nurse Specialist (AOCNS) to navigate a complex interplay between patient autonomy, informed consent, and the practical limitations of a specific treatment protocol, all within the strict regulatory framework governing oncology care in the United States. The patient's expressed desire for a treatment not currently recommended by the standard of care, coupled with their perceived understanding, necessitates a delicate balance between respecting their wishes and ensuring they receive evidence-based, safe, and effective care. The AOCNS must act as a bridge between the patient's desires and the clinical realities, ensuring that any decision is truly informed and aligned with ethical and legal obligations. Correct approach analysis. The correct approach, which involves a comprehensive discussion with the patient about the risks, benefits, and alternatives to the requested treatment, alongside an exploration of their values and goals, represents best professional practice. This aligns with the core principles of patient-centered care and informed consent as mandated by U.S. healthcare regulations and ethical guidelines, such as those outlined by the Oncology Nursing Society (ONS) and the American Nurses Association (ANA) Code of Ethics. Specifically, it upholds the patient's right to self-determination while ensuring the AOCNS fulfills their duty to educate and advocate for safe, evidence-based care. This approach prioritizes shared decision-making, where the patient's values are integrated with clinical expertise to arrive at the most appropriate plan of care. Incorrect approach is analysis. One incorrect approach involves immediately deferring to the patient's request without a thorough discussion of alternatives and risks. This fails to meet the regulatory requirement for informed consent, which necessitates a comprehensive understanding of all viable options, not just the patient's preferred choice. Ethically, it could be construed as a failure to advocate for the patient's well-being by not fully exploring safer or more effective alternatives. Another incorrect approach is to dismiss the patient's request outright based solely on the standard of care, without exploring the underlying reasons for their preference or engaging in a dialogue about their values and goals. This disregards the principle of patient autonomy and can lead to a breakdown in the therapeutic relationship. Legally and ethically, it may violate the patient's right to participate in their treatment decisions. A third incorrect approach is to proceed with the requested treatment without documenting the comprehensive discussion, the patient's understanding, and the rationale for deviating from the standard of care. This creates a significant regulatory and legal vulnerability, as it fails to demonstrate that informed consent was properly obtained and that the patient's decision was truly informed. It also undermines the principles of accountability and transparency in healthcare. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening to understand the patient's perspective and concerns. This should be followed by a thorough assessment of the patient's understanding of their diagnosis and treatment options. Next, the AOCNS must clearly articulate the evidence-based standard of care, including its risks, benefits, and alternatives, in a manner that is understandable to the patient. Crucially, the professional must then explore the patient's values, goals, and preferences to facilitate shared decision-making. If a patient's request deviates from the standard of care, the AOCNS must engage in a detailed discussion about the implications of such a deviation, ensuring the patient comprehends the potential consequences. Documentation of this entire process is paramount. Question 9. The efficiency study reveals a significant increase in the utilization of germline genetic testing for hereditary cancer syndromes among patients presenting with early-stage breast cancer. Considering the ethical and legal obligations of an advanced oncology certified clinical nurse specialist AOCNS in the United States, which of the following approaches best reflects the required standard of care when discussing germline genetic testing with these patients? Option A. Providing a detailed explanation of the specific genetic mutations that can be identified, the technical methodology of the testing, and facilitating the collection of the specimen, with a follow-up appointment scheduled to discuss results. Option B. Offering germline genetic testing as a routine part of the diagnostic workup, emphasizing its potential to identify actionable mutations and recommending immediate referral to a genetic counselor for all positive results. Option C. Engaging in a comprehensive discussion about the purpose, benefits, risks, and limitations of germline genetic testing, ensuring the patient understands the implications for themselves and their family, and facilitating informed consent prior to testing, with appropriate genetic counseling referral. Option D. Informing the patient that germline genetic testing is recommended for all individuals with early-stage breast cancer, and proceeding with testing if the patient expresses any interest, without further detailed explanation of the process or potential outcomes. The correct answer is A. Providing a detailed explanation of the specific genetic mutations that can be identified, the technical methodology of the testing, and facilitating the collection of the specimen, with a follow-up appointment scheduled to discuss results. Explanation. The efficiency study reveals a significant increase in the utilization of germline genetic testing for hereditary cancer syndromes among patients presenting with early-stage breast cancer. This scenario is professionally challenging because it necessitates a nuanced understanding of the ethical, legal, and clinical implications of genetic information, particularly in the context of patient autonomy, informed consent, and potential implications for family members. The AOCNS must balance the benefits of early identification and risk reduction with the potential for psychological distress, genetic discrimination, and the complexities of genetic counseling. The correct approach represents best professional practice because it prioritizes comprehensive patient education and shared decision-making, aligning with the ethical principles of beneficence, non-maleficence, and respect for autonomy. This approach ensures that patients understand the purpose, limitations, and potential consequences of germline genetic testing, enabling them to make informed choices that are congruent with their values and goals. It also acknowledges the AOCNS' role in facilitating appropriate referrals for genetic counseling and ensuring that follow-up care is tailored to the individual's genetic profile and risk assessment, adhering to professional standards of care and regulatory expectations for advanced practice nursing. An incorrect approach that focuses solely on the technical aspects of genetic mutation identification, without adequate patient counseling, fails to uphold the ethical obligation of informed consent. This oversight can lead to patients undergoing testing without fully grasping its implications, potentially causing undue anxiety or leading to decisions that are not in their best interest. Another incorrect approach that involves sharing genetic information with family members without explicit patient consent violates patient privacy and confidentiality, which are fundamental legal and ethical tenets. This action could result in legal repercussions and erode patient trust. A third incorrect approach that relies on outdated or incomplete genetic testing panels without considering the evolving landscape of genetic research and clinical guidelines may lead to misdiagnoses or inaccurate risk assessments, thereby failing to provide optimal patient care and potentially contravening standards of practice. Professional decision-making in such situations requires a systematic process that begins with assessing the patient's understanding and readiness for genetic testing. This involves a thorough discussion of the benefits, risks, and alternatives, ensuring that the patient's questions are addressed comprehensively. The AOCNS should then facilitate access to qualified genetic counselors for in-depth counseling and support. Furthermore, it is crucial to stay abreast of current guidelines and evidence-based practices regarding genetic testing and cancer risk assessment, ensuring that the chosen testing modalities are appropriate and that the interpretation of results is clinically relevant. Finally, ongoing patient support and follow-up care, tailored to the genetic findings and individual needs, are essential components of ethical and effective oncology nursing practice. Question 10. The assessment process reveals a patient with advanced non-small cell lung cancer experiencing progressive disease despite standard chemotherapy. Imaging and biomarker analysis suggests significant tumor angiogenesis. As an advanced oncology certified clinical nurse specialist AOCNS, what is the most appropriate next step in managing this patient's care, considering the impact of angiogenesis on treatment response? Option A. Continue with the current chemotherapy regimen, as angiogenesis is a complex biological process not directly addressed by standard cytotoxic agents. Option B. Initiate a trial of high-dose vitamin supplements based on anecdotal evidence suggesting their role in modulating tumor microenvironment. Option C. Evaluate the patient for eligibility for targeted therapies that inhibit angiogenesis in collaboration with the oncology team, and discuss potential benefits and risks with the patient. Option D. Recommend palliative care consultation solely for symptom management, as the underlying angiogenic drive makes further curative intent treatment unlikely to be effective. The correct answer is C. Evaluate the patient for eligibility for targeted therapies that inhibit angiogenesis in collaboration with the oncology team and discuss potential benefits and risks with the patient. Explanation. The assessment process reveals a complex clinical scenario where a patient's advanced lung cancer is exhibiting significant angiogenesis, impacting treatment efficacy and prognosis. The challenge lies in the AOCNS' responsibility to integrate the latest scientific understanding of angiogenesis into evidence-based nursing practice, ensuring patient care aligns with established oncology nursing standards and regulatory expectations within the U.S. healthcare framework. This requires a nuanced understanding of how to apply knowledge of angiogenesis inhibitors and their potential impact on patient outcomes, while also considering patient-specific factors and the ethical imperative to provide optimal care. The correct approach involves a comprehensive assessment of the patient's current treatment regimen, considering the potential benefits and risks of incorporating or adjusting therapies that target angiogenesis. This aligns with the AOCNS' role in advanced practice nursing, which mandates the use of current research and best practices to inform clinical decision-making. Specifically, it requires the AOCNS to evaluate the patient's response to existing treatments, identify potential resistance mechanisms related to angiogenesis, and collaborate with the interdisciplinary team to explore targeted therapies. This approach is ethically sound, prioritizing patient well-being and informed consent, and is consistent with the professional standards of oncology nursing practice as outlined by relevant U.S. regulatory bodies and professional organizations that guide advanced practice nursing. An incorrect approach would be to solely focus on the patient's current symptoms without considering the underlying angiogenic processes driving tumor growth and metastases. This fails to address the root cause of treatment resistance and could lead to suboptimal patient outcomes. Ethically, it represents a failure to provide comprehensive and proactive care. Another incorrect approach would be to unilaterally initiate novel anti-angiogenic therapies without thorough interdisciplinary consultation and adherence to institutional protocols and regulatory guidelines for off-label use or experimental treatments. This poses significant risks to the patient, including potential adverse events, and violates principles of collaborative practice and patient safety. It also disregards the established pathways for evidence-based treatment escalation and could lead to regulatory scrutiny. A third incorrect approach would be to dismiss the significance of angiogenesis in this patient's case, relying solely on traditional chemotherapy regimens without exploring newer therapeutic modalities. This demonstrates a lack of engagement with current oncology research and advancements, potentially limiting the patient's access to more effective treatments and falling short of the AOCNS' mandate to provide cutting-edge care. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, diagnostic findings, and treatment history. The AOCNS should then engage in a thorough review of current literature and evidence-based guidelines pertaining to angiogenesis in the specific cancer type. Collaboration with oncologists, researchers, and other members of the multidisciplinary team is paramount to discuss treatment options, potential benefits, risks, and patient preferences. This collaborative approach ensures that care is individualized, evidence-based, and ethically sound, adhering to all applicable U.S. healthcare regulations and professional standards. Question 11. Compliance review shows that an AOCNS is educating a patient newly diagnosed with non-small cell lung cancer, NSCLC, about their treatment options. The patient's tumor has been identified as having an EGFR mutation. Which of the following approaches to patient education best aligns with current U.S. regulatory expectations for advanced oncology nursing practice and the principles of precision medicine? Option A. Explaining how the EGFR mutation specifically drives tumor growth and how targeted therapies like EGFR inhibitors work to block this pathway, leading to tumor shrinkage. Option B. Focusing on the importance of palliative care and symptom management for advanced lung cancer. Option C. Providing a general overview of NSCLC, including its common symptoms, risk factors, and the different stages of the disease. Option D. Discussing the various types of chemotherapy commonly used for NSCLC and their potential side effects. The correct answer is A. Explaining how the EGFR mutation specifically drives tumor growth and how targeted therapies like EGFR inhibitors work to block this pathway, leading to tumor shrinkage. Explanation. This scenario is professionally challenging because it requires the Advanced Oncology Certified Clinical Nurse Specialist, AOCNS, to navigate complex cancer biology concepts within the strict confines of regulatory compliance, specifically focusing on the U.S. regulatory framework for advanced practice nursing and oncology care. The AOCNS must ensure that patient care decisions and educational interventions are not only evidence-based, but also align with the scope of practice and standards of care, as defined by relevant U.S. professional organizations and state nursing boards. The core challenge lies in translating intricate molecular and cellular mechanisms of cancer into actionable, compliant nursing practice. The correct approach represents best professional practice because it directly addresses the regulatory requirement to provide evidence-based, patient-centered care that respects the patient's autonomy and understanding of their disease. By focusing on the specific genetic mutations driving the tumor's growth and the targeted therapies that address these mutations, the AOCNS is adhering to the principles of precision medicine, which is increasingly emphasized in oncology guidelines and regulatory expectations. This approach ensures that patient education is accurate, relevant, and empowers informed decision-making, aligning with the ethical principles of beneficence and respect for persons, and the regulatory mandate for competent and ethical advanced practice. An incorrect approach that focuses solely on the general characteristics of the tumor type, without delving into the underlying molecular drivers, fails to meet the standard of care for precision oncology. This is a regulatory failure, because it neglects the advancements in cancer biology that inform targeted treatment selection, potentially leading to suboptimal patient outcomes and a deviation from evidence-based practice standards. Another incorrect approach that prioritizes a broad overview of cancer biology without linking it to the patient's specific diagnosis and treatment plan is also a regulatory and ethical failure. This approach lacks the specificity required for effective patient education and shared decision-making, potentially overwhelming the patient with irrelevant information and failing to address their immediate concerns and treatment options. It does not demonstrate the depth of knowledge expected of an AOCNS in applying cancer biology to clinical practice. A further incorrect approach that emphasizes palliative care without first thoroughly exploring all potentially curative or disease-modifying targeted therapies based on the tumor's molecular profile would be a significant regulatory and ethical misstep. While palliative care is crucial, its integration must be informed by the full spectrum of treatment possibilities, including those guided by advanced cancer biology. Failing to do so could be interpreted as a failure to provide comprehensive care and potentially limit the patient's access to life-extending or life-improving treatments, violating the principle of justice and beneficence. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's specific cancer diagnosis, including its molecular and genetic profile. This should be followed by a thorough review of current evidence-based guidelines and research pertaining to targeted therapies and their mechanisms of action. The AOCNS must then translate this complex information into clear, understandable language for the patient, facilitating informed consent and shared decision-making. This process is guided by regulatory frameworks that mandate evidence-based practice, patient advocacy, and the highest standards of professional conduct. Question 12. Cost-benefit analysis shows that a novel therapeutic approach targeting the tumor microenvironment demonstrates promising preclinical and early-phase clinical data for a specific subset of advanced lung cancer patients, but its long-term efficacy and safety profile in a broader population are not yet fully established. As an AOCNS, what is the most appropriate next step in evaluating this intervention for potential integration into clinical practice? Option A. Immediately implement the novel therapeutic approach for all eligible patients to ensure they receive the most advanced care available. Option B. Defer consideration of the novel therapeutic approach until extensive phase Roman III clinical trial data is published and widely accepted by the oncology community. Option C. Initiate a formal risk-benefit assessment and feasibility study involving multidisciplinary team input and a review of institutional capacity for implementation and monitoring to determine its suitability for further investigation or adoption. Option D. Advocate for the immediate discontinuation of all current standard of care treatments for this patient population to explore this promising new option. Correct answer is C. Initiate a formal risk-benefit assessment and feasibility study involving multidisciplinary team input and a review of institutional capacity for implementation and monitoring to determine its suitability for further investigation or adoption. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Advanced Oncology Certified Clinical Nurse Specialist (AOCNS) to balance the potential benefits of an innovative therapeutic approach targeting the tumor microenvironment with the inherent risks and resource implications. The rapid evolution of understanding the tumor microenvironment necessitates a proactive yet cautious approach to integrating new strategies into patient care, ensuring that patient safety and evidence-based practice remain paramount. The AOCNS must critically evaluate the available evidence, consider the patient population's specific needs, and align decisions with institutional policies and regulatory guidelines. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based risk assessment. This aligns with the core tenets of advanced nursing practice, which mandate the use of current scientific knowledge and clinical expertise to guide patient care. Specifically, it adheres to the principles of patient advocacy and the ethical obligation to do no harm, non-maleficence. By conducting a thorough evaluation of potential benefits against risks, including the feasibility of implementation and the availability of robust supporting data, the AOCNS ensures that any proposed intervention is both safe and effective for the intended patient population. This approach is further supported by the regulatory framework that emphasizes quality improvement and the responsible adoption of new technologies and treatments within oncology care. Incorrect approaches analysis. One incorrect approach involves immediately adopting the novel therapeutic strategy without a comprehensive risk assessment. This fails to meet the professional standard of care by bypassing essential due diligence. Ethically, it violates the principle of non-maleficence by potentially exposing patients to unproven risks. Regulatory failure lies in not adhering to established protocols for evaluating and implementing new treatments, which often require institutional review board approval or similar oversight mechanisms to ensure patient safety and data integrity. Another incorrect approach is to dismiss the novel strategy solely due to its novelty, without a thorough evaluation of its potential benefits. This represents a failure of professional responsibility to stay abreast of advancements in oncology and to critically appraise emerging evidence. Ethically, it could be seen as a failure to uphold the principle of beneficence by potentially withholding a beneficial treatment from patients. Regulatory failure might occur if institutional policies mandate the exploration of promising new therapies through appropriate evaluation channels. A third incorrect approach is to focus exclusively on the cost of implementing the new strategy without adequately weighing the potential clinical benefits and patient outcomes. While fiscal responsibility is important, it should not supersede the primary ethical obligation to provide the best possible patient care. This approach risks prioritizing financial constraints over patient well-being, which is a significant ethical and professional failing. Regulatory frameworks often require a demonstration of clinical value and patient benefit to justify resource allocation for new treatments. Professional reasoning. Professionals should employ a decision-making process that begins with identifying the clinical problem or opportunity. This is followed by a comprehensive literature review to understand the current evidence base. Next, a risk-benefit analysis should be conducted, considering patient-specific factors, potential harms, and expected outcomes. This analysis should be informed by institutional policies, ethical principles, and relevant regulatory guidelines. Finally, a collaborative approach involving the interdisciplinary team, patients, and their families is crucial for informed decision-making and implementation. Question 13. Compliance review shows an advanced oncology certified clinical nurse specialist, AOCNS, is managing a patient with advanced lung cancer experiencing significant, progressive peripheral neuropathy secondary to chemotherapy. The patient reports increasing difficulty with fine motor skills, ambulation, and a constant burning pain in their hands and feet, impacting their ability to perform daily living activities and sleep. The AOCNS is considering the next steps in managing this complex symptom. Which of the following approaches best reflects current evidence-based practice and regulatory expectations for an AOCNS in the U.S.? Option A. Recommend discontinuing all further chemotherapy treatments immediately to prevent further progression of the neuropathy without further assessment of the oncologic benefit. Option B. Initiate a trial of gabapentin or pregabalin. Provide comprehensive patient education on self-management strategies such as temperature regulation and protective footwear, and refer the patient for physical therapy evaluation to address gait instability and functional limitations. Option C. Advise the patient that neuropathy is an expected side effect of chemotherapy and that interventions are limited, focusing primarily on reassurance. Option D. Increase the patient's current opioid analgesic dosage to manage the reported pain, with a focus on achieving adequate pain relief. The correct answer is B. Initiate a trial of gabapentin or pregabalin. Provide comprehensive patient education on self-management strategies such as temperature regulation and protective footwear, and refer the patient for physical therapy evaluation to address gait instability and functional limitations. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in oncology nursing, managing chemotherapy-induced peripheral neuropathy, CIPN, in a patient experiencing significant functional decline and pain. The challenge lies in balancing symptom management, maintaining patient quality of life, and adhering to evidence-based practice and regulatory guidelines for advanced practice registered nurses, APN, in the U.S. The APN must integrate pharmacological and non-pharmacological interventions, consider patient-specific factors, and document interventions comprehensively, all while operating within the scope of practice defined by state nurse practice acts and professional oncology nursing standards. Correct approach analysis. The correct approach, which involves a multimodal strategy including pharmacological agents, patient education on self-management, and referral to physical therapy, represents best professional practice. This aligns with the Oncology Nursing Society (ONS) guidelines for managing CIPN, which emphasize a holistic and individualized approach. Pharmacological interventions, when appropriate and prescribed within the APN scope, are supported by evidence for symptom relief. Patient education empowers the patient to actively participate in their care, a key ethical principle promoting autonomy. Referral to physical therapy addresses the functional deficits and pain, promoting rehabilitation and improved quality of life, which is a core tenet of advanced nursing practice. This comprehensive approach is consistent with the APN responsibility to provide evidence-based, patient-centered care, as mandated by state APN licensure and scope of practice regulations. Incorrect approach is analysis. An approach solely focused on increasing opioid dosage without exploring other modalities fails to address the underlying mechanisms of neuropathy and may lead to opioid-related adverse events, contravening the principle of judicious medication use and potentially violating guidelines for pain management that advocate for multimodal approaches. This could be seen as a failure to adhere to best practices for symptom management and could be challenged under professional standards of care. An approach that dismisses the patient's subjective experience and focuses only on objective findings overlooks the significant impact of pain and functional limitations on the patient's well-being, which is a violation of ethical principles of beneficence and non-maleficence. It also fails to meet the standard of care for comprehensive symptom assessment and management, an approach that relies solely on non-pharmacological interventions without considering evidence-based pharmacological options when indicated may not provide adequate relief for severe symptoms, potentially leading to prolonged suffering and a diminished quality of life. This could be viewed as a failure to utilize all available evidence-based tools to optimize patient outcomes, potentially falling short of the standard of care. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment of the neuropathy, including its severity, impact on daily function, and the patient's subjective experience of pain and other symptoms. This assessment should guide the development of an individualized, evidence-based plan of care that incorporates pharmacological and non-pharmacological interventions. Collaboration with the patient and interdisciplinary team members, such as physical therapists and pain management specialists, is crucial. Documentation should be meticulous, reflecting the assessment, interventions, patient response, and any adjustments to the plan of care, ensuring accountability and continuity of care in accordance with state AOCNS regulations and professional standards. Question 14. The assessment process reveals a 55-year-old patient with a family history of breast and colon cancer who reports a sedentary lifestyle, a diet high in processed foods, and occasional exposure to industrial solvents at their workplace. The AOCNS is tasked with identifying the most critical areas for risk factor modification. Which of the following represents the most effective approach to guiding this patient's risk reduction strategies? Option A. Focusing on the immediate need for colonoscopies and mammograms based on age and family history, deferring lifestyle discussions. Option B. Prioritizing education on lifestyle modifications such as increased physical activity, dietary changes, and minimizing occupational exposures. Option C. Emphasizing the importance of regular genetic screening for BRCA and Lynch syndrome mutations due to the family history. Option D. Recommending a comprehensive environmental toxin panel to identify specific workplace exposures. The correct answer is C. Emphasizing the importance of regular genetic screening for BRCA and Lynch syndrome mutations due to the family history. Explanation. The assessment process reveals a complex interplay of factors influencing cancer risk, requiring the advanced oncology certified clinical nurse specialist, AOCNS, to synthesize information from various sources to provide comprehensive patient education and risk stratification. The professional challenge lies in accurately identifying and prioritizing modifiable versus non-modifiable risk factors, understanding their relative impact, and translating this knowledge into actionable, patient-centered interventions within the scope of oncology nursing practice, as defined by U.S. regulatory frameworks and professional nursing standards. The correct approach represents best professional practice by focusing on a holistic assessment that integrates patient history, lifestyle, environmental exposures, and genetic predispositions. This aligns with the U.S. regulatory framework for advanced practice nursing, which emphasizes evidence-based practice and patient advocacy. By prioritizing education on modifiable risk factors, the AOCNS empowers patients to make informed decisions that can potentially mitigate their cancer risk, a core ethical and professional responsibility. This approach is also consistent with guidelines from professional organizations such as the Oncology Nursing Society, ONS, which advocate for comprehensive risk assessment and patient education. An incorrect approach that solely focuses on genetic predisposition without considering lifestyle factors fails to acknowledge the significant impact of modifiable risks and may lead to patient anxiety without actionable steps. This overlooks the ethical imperative to provide comprehensive and practical guidance. Another incorrect approach that neglects to explore environmental exposures misses a crucial area of potential risk reduction and may violate the principle of beneficence by not fully addressing all avenues for prevention. An approach that overemphasizes rare genetic mutations without a thorough family history or clinical presentation could lead to unnecessary testing and patient distress, failing to meet the standard of care for a prudent clinical assessment. Professional decision-making in such situations requires a systematic approach. First, gather comprehensive data from the patient's medical history, social history, family history, and lifestyle. Second, critically appraise this information to identify both modifiable and non-modifiable risk factors. Third, Prioritize interventions based on the strength of evidence, patient's ability to modify the factor, and potential impact on cancer risk. Finally, engage the patient in shared decision-making, providing clear, understandable education and support to facilitate informed choices and adherence to recommended strategies. Question 15. The evaluation methodology shows that a 72-year-old patient with a newly diagnosed, locally advanced squamous cell carcinoma of the head and neck presents with significant comorbidities, including poorly controlled diabetes and a history of myocardial infarction. The patient expresses a strong desire to maintain their quality of life and avoid prolonged hospitalizations. The AOCNS is tasked with contributing to the decision-making process regarding potential surgical intervention. Considering the patient's overall condition and expressed wishes, which of the following approaches best reflects appropriate clinical judgment and adherence to professional standards for surgical indications in oncology? Option A. Suggest proceeding with neoadjuvant chemotherapy as the primary treatment modality, deferring any surgical considerations until after completion of systemic therapy without a thorough assessment of surgical resectability. Option B. Recommend a multidisciplinary evaluation to assess the patient's surgical candidacy, focusing on the potential for curative resection versus palliative surgical options, and to facilitate shared decision-making with the patient and family regarding treatment goals and risks. Option C. Advise the patient that surgery is not a viable option due to their advanced age and comorbidities, without exploring potential palliative surgical interventions or further multidisciplinary assessment. Option D. Advocate for immediate surgical consultation for a radical neck dissection, emphasizing the oncologic imperative to remove all gross tumor, irrespective of the patient's comorbidities or quality of life concerns. The correct answer is B. Recommend a multidisciplinary evaluation to assess the patient's surgical candidacy, focusing on the potential for curative resection versus palliative surgical options, and to facilitate shared decision-making with the patient and family regarding treatment goals and risks. Explanation. The evaluation methodology shows that the clinical scenario presents a complex decision-making challenge for an advanced oncology certified clinical nurse specialist, AOCNS. The challenge lies in balancing the patient's expressed wishes and quality of life considerations with the oncologic imperative for aggressive treatment, all within the framework of established surgical indications and techniques. The AOCNS must critically assess the patient's overall health status, the stage and type of cancer, potential surgical outcomes, and the patient's understanding and acceptance of risks and benefits. This requires a deep understanding of current oncology guidelines and best practices for surgical interventions in advanced disease. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and shared decision-making process. This aligns with the ethical principles of patient autonomy and beneficence, as well as regulatory requirements for informed consent and evidence-based care. Specifically, it involves a thorough evaluation of the patient's performance status, comorbidities, and the tumor's resectability, followed by a detailed discussion with the patient and their family about the risks, benefits, and alternatives to surgery. This collaborative approach ensures that the chosen course of action is not only oncologically sound, but also aligned with the patient's values and goals of care, adhering to standards of practice for advanced oncology nursing. An incorrect approach that focuses solely on the technical feasibility of a radical surgical resection, without adequately considering the patient's overall prognosis and quality of life, would be ethically and professionally deficient. This would violate the principle of non-maleficence by potentially subjecting the patient to significant morbidity without a commensurate benefit. Another incorrect approach, such as proceeding with surgery based on a limited understanding of the patient's advanced comorbidities or without a clear discussion of palliative care options, would fail to meet the regulatory standard for informed consent and patient-centered care. This would also disregard the AOCN's responsibility to advocate for the patient's best interests, which may include non-surgical management or symptom palliation. A third incorrect approach, such as deferring the surgical decision entirely to the surgeon without active AOCN's involvement in patient assessment and education, would represent a failure to utilize the advanced practice role to its full potential and could lead to suboptimal patient outcomes. Professional decision-making in such situations requires a systematic process. First, gathering comprehensive patient data, clinical, psychosocial, functional. Second, consulting relevant evidence-based guidelines and multidisciplinary team members. Third, assessing the patient's understanding and preferences. And finally, facilitating a shared decision-making process that respects patient autonomy while ensuring the delivery of safe and effective care. Question 16. The control framework reveals that when evaluating tumor response in a patient receiving immunotherapy for metastatic melanoma, which approach best aligns with current U.S. oncology practice guidelines and ethical considerations for advanced practice nursing. Option A. Conduct a thorough assessment that integrates objective imaging findings interpreted using RECIST criteria with the patient's reported symptoms, performance status, and consideration of potential immune-related adverse events mimicking progression. Option B. Primarily rely on the patient's subjective report of fatigue and decreased appetite, initiating a change in treatment if these symptoms worsen significantly, without correlating with objective imaging. Option C. Initiate a new treatment regimen based on anecdotal evidence from a recent oncology conference presentation regarding novel therapies, without formal restaging or comprehensive clinical assessment. Option D. Focus solely on the reduction in tumor size as measured by the most recent CT scan, proceeding with the current treatment regimen regardless of any new or worsening patient-reported symptoms. The correct answer is B. Primarily rely on the patient's subjective report of fatigue and decreased appetite, initiating a change in treatment if these symptoms worsen significantly, without correlating with objective imaging. Explanation. The control framework reveals that assessing tumor response in advanced oncology requires a nuanced approach that integrates objective measures with clinical judgment, adhering strictly to established guidelines for patient care and data integrity. This scenario is professionally challenging because the interpretation of tumor response is not always straightforward. Factors such as pseudoprogression, immune-related adverse events mimicking progression, and the limitations of imaging modalities can complicate accurate assessment. The Advanced Oncology Certified Clinical Nurse Specialist AOCNS must navigate these complexities to ensure timely and appropriate treatment adjustments, directly impacting patient outcomes and quality of life. The correct approach represents best professional practice because it prioritizes a comprehensive evaluation that aligns with the National Comprehensive Cancer Network, NCCN guidelines, which are the standard of care in the U.S. for oncology. These guidelines emphasize the use of standardized criteria like RECIST, response evaluation criteria in solid tumors, for measurable lesions, alongside clinical assessment of symptoms and performance status. This multimodal assessment ensures that treatment decisions are based on a holistic understanding of the patient's condition and the tumor's behavior, promoting patient safety and optimal therapeutic benefit. Adherence to these guidelines is ethically mandated to provide evidence-based care and maintain professional accountability. An incorrect approach that relies solely on subjective patient reporting of symptoms without objective imaging or clinical findings fails to meet the standard of care. This could lead to premature treatment discontinuation or unnecessary escalation, potentially harming the patient. Ethically, this violates the principle of beneficence by not acting in the patient's best interest based on robust evidence. It also fails to uphold the principle of non-maleficence by risking harm through misinformed decisions. Another incorrect approach that focuses exclusively on imaging findings, without considering the patient's overall clinical status or potential for immune-related effects, would be equally problematic. For instance, interpreting stable disease on imaging as a definitive endpoint without assessing for new symptoms or functional decline could delay necessary interventions. This approach neglects the holistic care expected of an AOCNS and could lead to suboptimal patient management, violating ethical obligations to provide comprehensive care. Finally, an approach that disregards established response assessment criteria in favor of anecdotal evidence or personal experience, without grounding in scientific literature or institutional protocols, represents a significant failure. This undermines the integrity of clinical decision-making and patient data, potentially leading to inconsistent and substandard care. It also fails to adhere to the professional responsibility of maintaining current knowledge and applying evidence-based practices, which are cornerstones of advanced nursing practice. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Review the patient's comprehensive clinical data, including history, physical examination, laboratory results, and prior treatment responses. 2. Apply standardized response assessment criteria, e.g., RECIST, to objective imaging data, noting any limitations or ambiguities. 3. Correlate imaging findings with the patient's subjective symptoms, performance status, and any new clinical signs. 4. Consider the specific cancer type, treatment regimen, and known patterns of response and resistance, including potential for pseudoprogression or immune-related effects. 5. Consult relevant clinical guidelines, e.g., NCCN, and multidisciplinary team members when complex interpretations arise. 6. Document the assessment thoroughly, justifying the interpretation of tumor response and the rationale for any subsequent treatment recommendations. Question 17. The monitoring system demonstrates an unexpected fluctuation in the radiation output during a patient's external beam radiation therapy session, exceeding the acceptable tolerance limits by a small but measurable margin. Option A. Immediately pause the treatment, assess the patient for any immediate adverse effects, and initiate the institution's protocol for equipment malfunction and radiation safety, including notifying the radiation oncology physicist and physician. Option B. Focus on ensuring the patient remains comfortable and calm, and wait for the radiation oncologist to complete their current patient encounter before reporting the monitoring system alert. Option C. Proceed with the treatment, but adjust the patient's position slightly to compensate for the perceived output variation, without consulting other team members. Option D. Continue the treatment at the current setting, assuming the fluctuation is minor and unlikely to cause significant harm, and document the observation for review at a later time. The correct answer is A. Immediately pause the treatment, assess the patient for any immediate adverse effects, and initiate the institution's protocol for equipment malfunction and radiation safety, including notifying the radiation oncology physicist and physician. Explanation. This scenario presents a professional challenge due to the potential for radiation exposure to both the patient and healthcare personnel, necessitating a robust risk assessment and adherence to established safety protocols. The AOCNS must integrate knowledge of radiation physics, patient care, and regulatory compliance to ensure optimal outcomes and minimize harm. The correct approach represents best professional practice because it prioritizes patient safety and regulatory adherence by proactively identifying and mitigating potential risks associated with radiation therapy. This aligns with the core principles of the Advanced Oncology Certified Clinical Nurse Specialist role, which includes advocating for patient safety, ensuring quality care, and maintaining compliance with relevant standards. Specifically, in the U.S., the Nuclear Regulatory Commission, NRC, and state-level radiation control programs mandate strict protocols for radiation safety, including regular equipment calibration, personnel dosimetry, and adherence to dose limits. The AOCN's role in overseeing and implementing these measures is critical. An incorrect approach that involves overlooking the monitoring system's alert fails to uphold the professional obligation to ensure patient safety and regulatory compliance. This could lead to subtherapeutic or supertherapeutic radiation doses, negatively impacting treatment efficacy and potentially causing acute or long-term toxicity. Ethically, this constitutes a breach of the duty of care. From a regulatory standpoint, it violates principles of radiation safety and quality assurance mandated by bodies like the NRC, potentially leading to citations and sanctions. Another incorrect approach that focuses solely on patient comfort without addressing the technical anomaly neglects the fundamental principles of radiation therapy delivery. While patient comfort is paramount, it cannot supersede the need for accurate and safe treatment. This approach fails to recognize that the monitoring system's alert indicates a potential deviation from prescribed treatment parameters, which directly impacts the patient's safety and the effectiveness of the therapy. This oversight could be construed as a failure to adhere to established clinical pathways and quality control measures, which are often implicitly or explicitly required by regulatory bodies to ensure consistent and safe patient care. A third incorrect approach that involves delaying intervention until a physician is available without immediate assessment or preliminary action can be problematic. While physician consultation is essential, the AOCNS has the expertise to perform an initial risk assessment and implement immediate safety measures, such as temporarily halting treatment or isolating the area if necessary, based on the alert. Delaying any action could exacerbate the risk of exposure or treatment error. This approach may not fully leverage the AOCNS scope of practice and could be seen as a failure to act promptly in a situation with potential safety implications, which is a cornerstone of professional nursing responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the alert and its potential implications. 2. Immediately assess the situation, referencing the monitoring system's data and any immediate environmental indicators. 3. Consult relevant institutional policies and procedures for radiation therapy emergencies or equipment malfunctions. 4. Implement immediate safety measures as per protocol, which may include halting treatment, securing the area, or notifying relevant personnel. 5. Communicate effectively with the radiation oncology team, including physicians, physicists, and dosimetrists, to determine the cause of the alert and the appropriate course of action. 6. Document all findings, actions taken, and communications thoroughly. Question 18. Assessment of a patient scheduled for their first cycle of a new chemotherapy regimen reveals a slight elevation in baseline liver enzymes compared to previous records, though still within the institution's acceptable range for initiation. The patient expresses some anxiety about the treatment and asks for clarification on the expected side effects beyond the common nausea. The AOCNS is preparing to administer the chemotherapy. Which of the following represents the most appropriate course of action? Option A. Inform the patient that the liver enzymes are slightly elevated but proceed with administration, focusing only on the immediate procedural aspects of chemotherapy delivery. Option B. Administer the chemotherapy as ordered, assuming the physician has already factored in the liver enzyme levels, and address the patient's specific concerns about side effects after the infusion is complete. Option C. Proceed with chemotherapy administration after confirming the physician's order and ensuring the patient is aware of the general risks, as the liver enzyme elevation is not critical. Option D. Delay chemotherapy administration and consult with the prescribing physician and pharmacist to evaluate the significance of the elevated liver enzymes in relation to the specific chemotherapy agent's hepatotoxicity profile and discuss potential patient education needs. The correct answer is C. Proceed with chemotherapy administration after confirming the physician's order and ensuring the patient is aware of the general risks, as the liver enzyme elevation is not critical. Explanation. This scenario presents a professional challenge due to the critical nature of chemotherapy administration and the potential for severe patient harm if errors occur. The Advanced Oncology Certified Clinical Nurse Specialist AOCNS must exercise sound clinical judgment, adhering strictly to established protocols and regulatory guidelines to ensure patient safety and optimal treatment outcomes. The complexity arises from balancing the need for timely and effective treatment with the inherent risks associated with cytotoxic agents. The correct approach represents best professional practice because it prioritizes patient safety through a systematic, evidence-based, and collaborative process. This involves a thorough assessment of the patient's current status, verification of the prescribed chemotherapy regimen against established guidelines and institutional protocols, and confirmation of the patient's understanding and consent. This aligns with the core principles of patient advocacy and the nurse's responsibility to ensure safe and competent care as mandated by professional nursing standards and regulatory bodies governing advanced practice nursing in the U.S. Specifically, adherence to the National Council of State Boards of Nursing, NCSBN, Nurse Practice Act, and the Oncology Nursing Society ONS, standards of practice for the AOCNS role are paramount. An incorrect approach that involves proceeding with administration without confirming the patient's understanding of potential side effects and the rationale for the specific regimen fails to uphold the ethical principle of informed consent. This is a regulatory failure as it violates patient rights and potentially exposes the institution to legal ramifications. Another incorrect approach, such as relying solely on the physician's verbal order without independent verification against the patient's record and institutional policy, bypasses crucial safety checks and increases the risk of medication errors, which is a direct violation of safe medication administration practices and regulatory requirements for medication reconciliation. Lastly, an approach that delays administration due to minor, non-critical deviations in the patient's vital signs without consulting relevant protocols or the prescribing physician demonstrates a lack of clinical judgment and potentially compromises treatment efficacy, which can be considered a failure to provide timely and appropriate care. Professionals should employ a decision-making framework that begins with a comprehensive patient assessment, followed by a meticulous review of the prescribed therapy, cross-referencing with patient history, laboratory values, and institutional policies. Collaboration with the interdisciplinary team, including the physician, pharmacist, and patient, is essential. This framework emphasizes critical thinking, adherence to evidence-based practice, and a commitment to patient safety and autonomy. Question 19. Comparative studies suggest that a multidisciplinary approach to cancer screening significantly improves early detection rates. An advanced oncology certified clinical nurse specialist, AOCNS, is tasked with enhancing the screening and early detection program within a community health center serving a diverse and underserved population. Which of the following strategies best aligns with current evidence-based practice and regulatory expectations for improving cancer screening uptake and effectiveness in this setting? Option A. Implementing a targeted patient education campaign focusing on the importance of self-awareness of cancer signs and symptoms, coupled with a robust system for provider education on updated screening guidelines and a streamlined referral process for diagnostic workups. Option B. Focusing resources on advanced diagnostic imaging technologies for all eligible patients, irrespective of their individual risk factors or the presence of symptoms, to maximize detection potential. Option C. Relying primarily on annual physician-led physical examinations to identify potential signs of cancer, assuming that routine checkups will capture most early-stage malignancies. Option D. Developing a protocol for opportunistic screening based on patient self-reporting of concerns during any clinical encounter, without a structured approach to guideline adherence or follow-up. The correct answer is A. Implementing a targeted patient education campaign focusing on the importance of self-awareness of cancer signs and symptoms, coupled with a robust system for provider education on updated screening guidelines, and a streamlined referral process for diagnostic workups. Explanation. This scenario is professionally challenging due to the inherent complexities of implementing evidence-based screening guidelines within a diverse patient population, balancing resource allocation, and ensuring equitable access to care. The AOCNS must navigate patient-specific factors, provider education, and systemic barriers to effective early detection. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered strategy grounded in current evidence and regulatory mandates. This involves a multifaceted approach that includes direct patient education on risk factors and screening modalities, provider education to ensure consistent application of guidelines, and the development of accessible referral pathways. This aligns with the core principles of the AOCNS role, which include promoting evidence-based practice, advocating for patient well-being, and contributing to improved health outcomes through proactive interventions. Adherence to established screening guidelines, often codified by professional organizations and regulatory bodies, is paramount to ensuring quality care and minimizing diagnostic delays, thereby improving prognosis. An incorrect approach that focuses solely on physician-led screening without patient engagement fails to acknowledge the importance of shared decision-making and patient empowerment, potentially leading to lower adherence rates and missed opportunities for early intervention. This neglects the ethical imperative to involve patients in their own healthcare decisions. Another incorrect approach that relies on outdated or non-evidence-based screening methods disregards the professional obligation to practice according to the most current and validated scientific knowledge, potentially leading to false positives, false negatives, and patient harm. This constitutes a failure to adhere to professional standards of care, an approach that neglects to address systemic barriers to screening, such as access to diagnostic services or insurance coverage, creates an inequitable care environment, and fails to meet the needs of all patients, violating principles of social justice in healthcare. The professional decision-making process for similar situations should involve a systematic evaluation of the evidence, consideration of patient demographics and needs, assessment of available resources, and consultation with relevant stakeholders. The AOCNS should champion the integration of evidence-based screening protocols into clinical practice, advocate for patient education and engagement, and work to dismantle barriers that impede timely and effective early detection of cancer. This requires continuous learning, critical appraisal of new research, and a commitment to patient advocacy. Question 20. Benchmark analysis indicates that monitoring for treatment side effects in patients receiving novel targeted oncology therapies requires a nuanced approach. Considering the advanced scope of practice for an advanced oncology certified clinical nurse specialist, AOCNS, which of the following represents the most appropriate and ethically sound strategy for monitoring potential adverse events? Option A. Defer all monitoring and management of treatment side effects to the prescribing physician, intervening only when directly instructed to do so. Option B. Implement a proactive, individualized monitoring plan that integrates patient self-reporting with systematic nursing assessments, informed by the specific drug's known toxicity profile and the patient's baseline health status, with clear protocols for escalation of care. Option C. Focus exclusively on monitoring for the most frequently reported side effects as listed in the drug's official prescribing information, assuming less common events are unlikely. Option D. Rely primarily on patient self-reporting of symptoms, intervening only when the patient explicitly expresses severe discomfort or concern about a specific side effect. The correct answer is B. Implement a proactive, individualized monitoring plan that integrates patient self-reporting with systematic nursing assessments, informed by the specific drug's known toxicity profile and the patient's baseline health status, with clear protocols for escalation of care. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in oncology nursing, managing the complex and potentially life-threatening side effects of novel targeted therapies. The rapid evolution of these agents means that even experienced AOCNS professionals must remain vigilant and adapt their monitoring strategies. The challenge lies in distinguishing between expected, manageable toxicities and emergent, potentially irreversible adverse events that require immediate intervention. Furthermore, the patient's individual response, comorbidities, and adherence to treatment all contribute to the complexity of accurate assessment and timely decision-making. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized, and proactive monitoring strategy informed by the specific drug's known toxicity profile and the patient's baseline status. This aligns with the core principles of advanced practice nursing, emphasizing patient safety and optimal outcomes. Regulatory frameworks, such as those guiding advanced practice nursing in the U.S., e.g., State Nurse Practice Acts, scope of practice guidelines from professional organizations like the Oncology Nursing Society, mandate that nurses assess, diagnose, and manage patient responses to therapy. This includes anticipating and monitoring for adverse events. Ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, further underscore the necessity of thorough monitoring. Best professional practice dictates a systematic approach that includes patient education, regular symptom assessment, and a clear plan for escalation of care when necessary. Incorrect approach is analysis. An approach that relies solely on patient self-reporting without systematic assessment fails to meet the standard of care. Patients may not recognize the significance of certain symptoms or may underreport due to fear or a desire to continue treatment. This could lead to delayed diagnosis and management of serious toxicities, violating the nurse's duty of care and potentially leading to adverse patient outcomes, which is a regulatory and ethical failure. Another incorrect approach is to only monitor for the most common side effects listed in the drug's package insert. While package inserts are important, they represent a summary of observed toxicities and may not capture rare but severe events or idiosyncratic reactions. Advanced practice nurses are expected to possess a deeper understanding of pharmacology and pathophysiology to anticipate a broader range of potential adverse events, especially with newer agents. Failure to monitor for less common but serious toxicities can result in significant patient harm, constituting a breach of professional responsibility and potentially violating regulatory standards for competent practice. A third incorrect approach is to defer all monitoring and management decisions to the prescribing physician without independent nursing assessment and intervention. While collaboration is essential, the AOCNS role involves independent assessment and management within their scope of practice. Over-reliance on the physician can lead to delays in addressing acute side effects that could be managed by the nurse, impacting patient comfort and potentially leading to more severe complications. This abdication of nursing responsibility is a failure to practice to the full extent of the AOCNS scope and may contravene regulatory expectations for advanced practice. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the specific targeted therapy, including its mechanism of action and known toxicity profile. This should be followed by a comprehensive baseline assessment of the patient, identifying any pre-existing conditions that might increase their risk for certain side effects. A proactive monitoring plan should then be developed, incorporating patient education on expected symptoms and when to report them, as well as a schedule for systematic nursing assessments. Crucially, this plan must include clear criteria for escalating care to the physician or other members of the healthcare team, ensuring timely and appropriate intervention for any concerning findings. Continuous reevaluation of the patient's response and adjustment of the monitoring plan based on emerging clinical data are also vital components of this framework.